Magandang umaga! Welcome to another edition of Ano Na Bev, Best Express Views on PHLB Radio and I Want TFC, your source of information and interesting subjects that matter to you and the community. On to our Tuesday topic, why consistent OB-GYN checkups are crucial for women's health and well-being. To help us discover the reason, today we will be discussing why it is important for women over 40 to follow an annual examination with their OB-GYN and receive the care that is right for them. A regularly scheduled screening for women such as mammograms, pap test, pelvic exams, and more are such examples. According to the American Cancer Society, among the top 6 causes of cancer deaths in the U.S., breast cancer ranks second, ovarian cancer ranks fourth, and uterine cancer ranks sixth. So with us today in the studio, we have Fil-am OB-GYN, Dr. Leanne Almario.
Hi, thank you so much, Beth.
Obstetrics and a gynecologist from the Stanford University School of Medicine. Her passion and interest in immunology and gynecologic oncology allowed her to further her research on macrophage re-education in ovarian cancer. Super impressive credentials, Doc. So welcome to the show.
Thank you so much. Yes.
Ayan. So what inspired you to become an OB-GYN doctor?
You know, I really liked being in the OR, and you think about what kind of population you want to specialize in, and I liked helping women. We go through a lot. So pap smears, childbirth, after childbirth, what to expect. So I really like that population. It's the population I wanted to connect with.
Wow. The challenge of reproductive system.
Yes. Oh my goodness.
Women's.
From beginning to end, essentially. From when you start your periods to undergoing menopause, there can be challenges. And so I think a lot of women want to go to a woman. And so that's why, I chose the field.
The macrophage, it's your research. Let's talk about a little bit about your research.
Yes.
What is macrophage? It's a cell?
Yeah, so it's one of our immune cells. It attacks, specifically bacteria, viruses. And so we wanted to see if macrophages could, attack cancer cells using our own immune system to attack cancer instead of chemotherapy.
Oh, wow.
Yeah.
What's this? So insightful. So what are some of the most common challenges that you face as an OB-GYN and how do you work to overcome them?
I think one of the challenges that we have is it's stressful. I mean,
like today, this morning, we were supposed to.
I know. When the babies come, when the babies want to come. And, sometimes the deliveries are challenging. Sometimes the prenatal care can be challenging. And so that's one of the challenges is that in OB-GYN, you have to kind of expect the unexpected and be prepared. Even though most of the time it's fine, things go very, very well. We're trained to handle when things don't go as planned.
Wow. So a lot of circumstances could occur during those, between those 4 hours of labor and all.
Oh my God.
Is it challenging or exciting on your part?
It's definitely exciting. It's definitely rewarding. You see the patient from the beginning to the very, very end, when the baby comes out. And so that's what keeps, me going, just because even though some of the nights can be pretty long. But it's very, very rewarding because your patient wants you to be there. And so it's a nice feeling when they come back to you for their second or third child.
Wow. Yeah. My first cousin is actually an OB-GYN in Palawan, Puerto Princesa, Palawan.
Really?
Manny
Nice.
Grace, hi. And Katie, the daughter, is also an OB-GYN now.
Oh, nice. Yeah.
So what, we talked about the challenges and how you overcome them. Could you share some tips or advice for women who are trying to conceive or who are going through pregnancy for the first time?
Yeah, I think one of the good things is to find an OB-GYN that you connect with, someone that you can, share your, any questions, any concerns, nothing too big or too small. Like finding an OB-GYN that you can, contact when you have issues or concerns. I think that's a good first step. And then also keeping yourself healthy, you know, nice, healthy weight, taking vitamins, good, healthy diet. Those are all things as a good foundation for a healthy pregnancy, taking care of yourself first.
Ayan. How do you approach conversations with patients about sensitive topics such as contraceptives, STDs, or pregnancy options?
Yeah. So I let them know that, you know, everything's confidential, you know, and just having a very good open mind, you know. I think one thing that people like about me is that, you know, I keep it open-minded and no judgment, because I understand that everybody's lives are different, and
they're entitled to privacy.
Yeah, and they're entitled to privacy, and, you know, I don't, you know, tell or judge whatever they choose to do.
Yes.
And, you know, women's reproductive rights are very sacred to them. It affects their lives a lot, you know, the decision to have children or not.
Yes. So, these are the dialogues between a doctor and a patient, and these are dialogues that you can assure them that everything is confidential. Correct?
Yes, yeah, and I think that's, you know, the most important thing that patients should have with their doctors, just making sure that they're comfortable with, again, extremely sensitive topics, just because, yeah, a lot of women's health issues are very sensitive.
Yes. Ang galing. So, what are some of the latest advancements of technologies in the field of obstetrics and gynecology, and how is it beneficial to the patients?
I think one of the newer technologies is cell-free DNA. It's great because you can know the sex of your baby pretty early, which is, you know, a nice highlight for some people.
Before it was just a 4D.
Yeah.
Remember, like 3D, I think it was 3D,
ultrasounds,
and then
now,
4D. So
so now, you know, you could learn about your baby very early. And then
how early?
Around 10 weeks.
10 weeks?
The earliest is 9,
Wow.
but 10 weeks. And then, you know, see if they have any conditions that can be, you know, pretty detrimental. And so I think a lot of women like that they can know a little bit more about their baby pretty early on. So that's one benefit. And then, you know, of course, good old pap smears. Pap smears have been reducing cervical cancer for many, many decades now. And so, you know, going back to the basics, just getting the pap smear has been crucial.
Yes. And how important is pap smear to the women nowadays?
Very important. Very, very, very
They could
important.
neglect it because
Yeah.
it's just like, you know, it's just, they're just so nonchalant about it. Like, I'll do it
Yeah.
next week, or I'll do it next month.
Yeah, or I'll do it
or
next
sometimes the
year.
insurance issue also, right?
Yeah,
But
and
these
so-
are preventative care that the insurance pays, or, you know, out of pocket pays, or
Yeah.
how does it work?
So yes, so it's great because most insurance companies will pay for a pap smear every year, even though if you have a normal pap smear, you don't need to go every single year, and that's why cervical cancer is so, you know, it's been getting better. It's not common anymore, as compared to developing countries. That the fact that we have access to pap smears, and it's nice because if you follow with your doctor, at least on a routinely basis, we can prevent it from ever getting to that point, to the cancer point. You know, the only times I've kind of seen cancer here in Las Vegas is when, you know, people don't go, and when it's a number of years where they ever see an OB-GYN.
And then
so
when they see it, it's already too late, right?
and it's already there. And so, you know, it's you know, a test that's not very painful. It's not super comfortable, but it's not painful. It's easy to do. And so I don't see why people don't want to do it. And I think it's because they get nervous about the exam, but, you know, I try to reassure them that it's not painful, and, you know, it's quick.
Yes, and it's important, it's vital, it's crucial.
And because, again, cervical cancer is one of those preventable diseases, which is great, but if somebody has it, it can be very, very, you know, harmful and
fatal.
It's not, fatal, and not super fun to have at all.
Oh, no. So let's pause for a break, and when we return on Anuna Bev, Dr. Almario will explain how to balance the medical needs of patients with their emotional and psychological needs during pregnancy and childbirth.
I'm a professional singer. That's how I support myself and my family. I'm a careful driver. The other car hit me. I ended up picking Richard Harris. Richard Harris is already an institution in Nevada. Dahil kay Richard Harris, tanggal ang worries.
I slipped. I hurt my tailbone. They sent me the bill. Si Richard Harris, siya lang ang tumanggap ng kaso ko. Tutulungan ka niya. Kay Richard Harris, tanggal ang worries.
The Richard Harris Law Firm, just in case.
Sabi ng patients ko, they don't need a colonoscopy because they don't feel anything. But colon cancer is a silent killer. It affects both men and women, mayaman man o mahirap. Have your colon checked.
Mobile Home Health, providing care in the comfort of your own home.
Serving Southern Nevada is our top priority.
And it's our greatest joy to help others stay safe and enjoy a better quality of life at home.
Because health is wealth.
Your head is a part of your whole body, just like your heart and the rest of your body. Huwag kang mahihiya dahil hindi ka nag-iisa. I'm your nurse practitioner, Cristina Pajara, advocating for mental health. Educate yourself and others. Choose empowerment. Call today.
Welcome back, ladies and gentlemen. Still with us, Southern Nevada Fil-am OB-GYN, Dr. Leanne Almario.
Thank you.
So, Doc, how do you balance the medical needs of your patients with their emotional and psychological needs during pregnancy and childbirth?
I think one of the things that I do during, their prenatal care is really listen to their worries, their concerns. After becoming a mom for the first time in 2021, I think it changed, how I operate as a doctor. When you experience what pregnancy and childbirth is like, you know how your patients feel, and you can relate to them. And so I try to listen to what their concerns are, and share with them my experience as well, and try to ease their mind whenever something comes up.
So what are some of the most rewarding experiences you've had as an OB-GYN?
I think definitely when patients come back, when they come back for their second child, and I see, the baby I delivered, I think that's really, really a rewarding part of the job. And, it makes the late nights really worth it, to be honest, just because it means a lot. They could go to somebody else, but it's nice when they come back for their second one, and they want to talk to you, they want to share pictures with you,
and you're a part of their lives too.
Yeah.
Your picture is hanging on the wall in the refrigerator with them.
Yeah, so it's really, really cool to see, because I think everyone will always remember like how their delivery was. Yeah.
Ayan. How do you see the field of obstetrics and gynecology evolving in the future, and what trends or changes do you anticipate?
So, I think our prenatal care will just get better and better. There's going to be more and more tests to, see, the ultrasounds will get better. Our prenatal diagnosis will get better. I think we're going to have better screening tests for breast cancer in the future. That's the one thing that can be challenging, where, mammograms are great, but they're not perfect yet. I think our birth control will always, get better and better as, more and more effective. And I think the biggest trend now that we're seeing is, non-hormonal ways of birth control, because a lot of women, they don't want hormones, but, it's having that second option of a non-hormonal birth control method. I think those are some of the ways, and hopefully there might be some male birth control methods in the future, just because, a lot of
besides
women
vasectomy.
hopefully that's in the works. But yeah, and I'm sure there is, just because, sometimes women don't want to be on birth control anymore. And so I think those are the kind of the new trending topics.
Just for my personal question.
Yeah.
Was there like a patient of yours who was super old? Like, how old was the pregnancy of a patient like you've delivered? Like the oldest patient that you personal experience?
In their 40s, like mid-40s, and it's getting more and more common. I mean, and people are, wanting to delay their childbearing, or people still want to have kids in their 40s. It's definitely a higher risk pregnancy, but I'm grateful that a lot of the patients that I've had, later in their lives have had healthy babies, and it's great.
Is it because of the biological clock of the women's? Is there more risk when they're older?
Yeah, of course. I always tell patients we're born with the eggs that we have, and so as we get older, they're more predisposed to any genetic abnormality, and so, obviously, an egg that's older is going to have be maybe less healthier than an egg when they're 20 years old. And so, I tell them to keep that in mind, and that the numbers are there, that it is a higher risk pregnancy with regards to abnormalities. But, with the right prenatal detection, sometimes we can see and hope that it's normal, that everything is fine.
And what about the Filipino, like in the Asian, the Asian population, especially in the Filipino Americans here in Las Vegas? Like, there are career driven, and they want to hold the pregnancy or the family planning.
Yeah,
it's okay. That's their prerogative.
Yeah,
but
I think it's okay.
Your thoughts on that?
And I tell patients, yes, you have to build a foundation first. You can't just have kids without being prepared. But I also tell them that, as women, we have to think about our clocks, unfortunately, and be at least prepare. And I tell them, if biological children is something you truly want, you have to be prepared, whether it's, egg freezing or planning to have children at a certain age. Just because, again, it does get harder as we get older.
Ayan. And lastly, we have a question from one of our viewers from Henderson, Nevada, that what advice would you give to aspiring OB-GYN doctors, and how can they prepare for a successful career like yours?
I think, the best career advice is to be flexible and to be willing to expect the unexpected, and to be okay with a little stress under pressure. And having a lot of help. I couldn't do this job without the help of my parents, taking care of my kids. And so I think that's going to be the biggest thing. And with any career, and having a career in children, you have to be prepared and be willing to ask for help when you need it the most.
Ayan. And also, the recent death of a celebrity, every time there's a death of a celebrity, the focal point of that becomes the cause of death. Yeah. So why, we don't talk about it until someone dies, like someone famous dies, or an actress, an actor. The ovarian cancer recently, right? Everybody it does not chooses any age. It does not chooses rich or poor. Yeah. Everybody anyone could get the ovarian cancer. Yeah. Is that through genetics, or is it because of their lifestyle, or what is it?
So there are some syndromes that predispose patients to ovarian cancer, some familial syndromes, but most of them are sporadic, and so it can affect anyone, unfortunately. And unfortunately, with ovarian cancer, there isn't a good screening test that we have, and so it presents very, very late. But I do tell patients, if you're concerned, if you have any, symptoms that worry you,
or family who had
or family
ovarian
history
cancer
of ovarian cancer, then you should see your doctor and think and be willing to look for it, or undergo some tests. Even though the tests that we have aren't perfect right now, it's better to at least see rather than just wait for it to happen.
Ayan. So let's invite viewers, subscribers, onlookers to Dr. Leanne Almario's clinic located at 2851 North Teneo Way, Suite 208, Las Vegas, Nevada, United States of this America, 89128. Thank you very much for
Thank
your
you so
time and
much. Thank you so
insights,
much.
Doctor. Ano pa, give us some more tips for our kababayans out there who's listening and all the women from around the world who is listening right now. Give them their insights of what to do for pap smears, for
I mean, go to your doctor. If it's been, I get a lot of patients, it's been a number of years, 7, 8, 9, 10 years since they've seen a doctor. You have to. I mean, it's your only one life, and so and no question is silly, no question is too small. And I always tell patients, trust your gut. If you have a concern, there's probably a reason why. And so you should, go to your doctor, make an appointment, and just to reassure yourself everything's okay.
And you don't have to wait until it's
don't wait till
the
it's
severity
too late
of your situation.
Yeah,
right?
and be your own advocate. That's what I tell patients as well. Like, be your own advocate. There's no one who's going to advocate for your own health except you. And so, you can never be too careful.
Ayan. Ladies and gentlemen, Dr. Leanne Almario, OB-GYN here in Las Vegas, Nevada. Until next week on Ano na Bev, Best Express Views. Paalam na sa ngayon. Subscribe na!
I'm a professional singer. That's how I support myself and my family. I'm a careful driver. The other car hit me. I ended up picking Richard Harris. Richard Harris is already an institution in Nevada. Dahil kay Richard Harris, tanggal ang worries.
I slipped. I hurt my tailbone. They sent me the bill. Si Richard Harris, siya lang ang tumanggap ng kaso ko. Tutulungan ka niya. Kay Richard Harris, tanggal ang worries.
The Richard Harris Law Firm, just in case.
Sabi ng patients ko, they don't need a colonoscopy because they don't feel anything. But colon cancer is a silent killer. It affects both men and women, mayaman man o mahirap. Have your colon checked.
Mobile Home Health, providing care in the comfort of your own home.
Serving Southern Nevada is our top priority.
And it's our greatest joy to help others stay safe and enjoy a better quality of life at home.
Because health is wealth.
Your head is a part of your whole body, just like your heart and the rest of your body. Huwag kang mahihiya dahil hindi ka nag-iisa. I'm your nurse practitioner, Christina Pahara, advocating for mental health. Educate yourself and others. Choose empowerment. Call today